My patient is a 20-year-old male football player who plays for the university first team, is a right midfielder and has had no history of previous injuries. The mechanism of injury is a right rapid lateral lunge to try and block a shot, with his left foot in plantar flexion and external rotation. The problem is that we have with this patient is first of all pain, which was a 7 out of 10 when the injury first happened. This pain is very localised, about 15 centimetres proximal to the medial epicondyle of the femur. During rest, this pain is only about a 2 out of 10, but during active daily living and walking, this rises to a 5 out of 10 in the VAS score. Other problems that we have is an increase in swelling and inflammation, a decrease in range of motion, and a decrease in strength. Because of this, I believe that this injury is a grade 2B adductor magnus strain.
During the objective assessment, we found there was an increase in pain during active range of motion of the hip, inflection, extension, adduction, abduction, and internal rotation. However, no pain was found in passive range of motion, apart from when the hip was abducted and a soft tissue stretch was felt. In the muscle length tests, we found a reduction in hip abduction. This was found by Cejudo et al. 2015 to be indicative of a groin strain. In the Thomas test, we found tightness in the hip flexors. This is also found by Holmich 2014 to be indicative of a groin strain. In the resistant muscle tests, we found that there was weakness in the adductor squeeze. This is found by Nevin et al. 2013 to be indicative of a groin strain. We also found that there was a grade 3 on the Oxford scale, therefore indicative of a groin strain as well. Pain was found on palpation of the mid-belly of the adductor magnus. This is found by Holmich et al. 2014 to be indicative of a groin strain, also indicates that it might be a grade 2B adductor magnus strain from Pollock et al. 2014.
With your knee on the box, and what you're going to do is you're going to lift up as fast, and we're going to slowly work way down. Come up and slowly work way down. Here we want to keep our core nice and tight, and we want everything to be in line. You want your elbow to be in line with your hips and in line with your knees. Okay. So fast up, and then slowly down. Working that time under tension. So we increase the capacity of your groins and strengthen them. So here, brilliant. Okay, now what I want you to do, can you just lean a little bit back, further back, so you're nice and upright. Keep going. Settle up. I want your elbow to be in line with your hips and in line with your knees. So if you bring your elbow a little bit further back for me, please. So this elbow here. Okay. And come up. Nice, and slowly down, really slowly. And feel that eccentric. Yeah, nice, everything in line.
The reasoning for using the kneeling band-assisted Copenhagen is that it's the gold standard for groin rehabilitation. This is as it's functional, as it uses lots of different muscles, as well as the adductors, including the obliques, transverse abdominals, and the iliopsoas muscles. To try and make the exercise easier and decrease the intensity but increase the volume of the exercise, we've made the exercise kneeling and band assisted. This decreases the load so we can increase the volume and increase the capacity of the muscles. What will also increase the capacity of the muscles is the eccentric portion of this exercise. To progress the kneeling banded assisted Copenhagens, we can increase the volume. This is by increasing the number of reps and sets that we do to increase the amount of capacity that the adductors can go under. We can also increase that frequency that we do this exercise, going from once a week to 2 to 3 times a week. We can then start to add destabilising techniques. These are very light movements with just little flicks and pulls of the resistant band to try and destabilise, to increase the work that the adductor muscles have to go under to try and stabilise the movement. Once the patient is able to do full Copenhagen's with a moderate amount of volume, we can then go to towel sweeps. Towel sweeps are quite a fast movement where you get a towel and you plunge across and you hit the towel against the wall. This is useful as it's a faster movement, therefore the adductors need to work a little bit harder to try and eccentrically slow the movement down. It also mirrors a similar mechanism of injury that the athlete had when they injured their groins. From this, we can then go to med ball throws. This, as it's quite a fast movement that needs a lot of power generated from the muscles, therefore being able to train the adductor magnus in this range and in this way will mean that it will increase the capacity to be able to deal with these loads. With our hips at 45 degrees and placing a ball in between our knees and squeezing the ball nice and tightly. While we're down here, we're going to brace our core with our transverse abdominals and make sure we're nice and tight and stable. Then we're going to hip thrust and we're going to try and get our hips as high to the sky as possible. Here this really contracts the glutes, it makes them most strong, increases the contraction, and we're also going to pull with our heels up to our head. This increases the contraction in the hamstrings as well as the adductors. This exercise is good at training the transverse abdominals, the glutes, the hamstrings, but most importantly the adductors, with an isolated muscle contraction increasing the amount of strength in the adductors. Brace your core for me. What does it feel? Yeah, nice and braced. And please make hip thrusts, so you get your hips as high to the sky as possible. Nice. Keeping your core nice and strong. And so you're not in a nice straight line. And down again. And go up. And down again. Really try and not curve your spine. To make it nice and flat the whole way. Yeah, let's go again. Yes, it's better. That's lots better. Try and bring your heels up a little bit more. So shuffle the heels up a little bit further, that'd be good. And again, we're going to do 12 reps of these. Keep that core nice and straight, that back nice and straight. Yeah, that's good. Really pulling with your heels up towards the heads as well. Brilliant, cool. The reason for this is that there's an increased contraction, specifically in the adductor magnus. It also helps with hip extension. So therefore, when we have a ball squeeze, which contract the adductors alongside a hip extension exercise like a hip thrust, we can increase the contraction. To progress this exercise, what we can do is get different size balls for the adductor squeeze, therefore having an isometric contraction in different ranges of motion. What we can also do then is lean the thoracic spine onto a box into a normal hip thrust position and do the same. This increases the starting flexion of the hips, so therefore there's more extension, so you have more contraction. What we can do then is increase the weight, so we can use a barbell to increase the contraction and therefore make the muscles stronger by increasing weight and volume. But then we can also work this into an RDL, where there is a strong eccentric force, increasing neuromuscular control and increasing strength with mechanical coupling. But then to progress this even further, what we can do is a single leg RDL. Here, this will focus largely on the stabilizers, increasing their strength, increasing their capacity, therefore reducing the likelihood of re-injury. Here, what you need to have some sort of fabric, something to be able to slide on the floor to do this exercise. So here we've got a jumper, and what you're going to do is you're going to stand 1 foot on, and you're going to externally rotate your hip for your toes to be facing about 10 o'clock on the clock. And then what you're going to do is you're going to slowly slide out and come back in. You're going to slowly slide out. Go to a soft tissue stretch where you feel comfortable, where you feel a bit of pain, there's a bit of stretch in your adductors, and then you can come back up. When you come back up, you want to be using your sliding leg to push back up. This is really contracting the adductor muscles increasing their strength. So we go again. You really want to try and keep your core nice and straight. And you don't want to be bending around all over the place. And externally rotate your hips, so your left toes are pointing to about 10 o'clock on the clock. Okay, and then you're going to slowly slide down to come into a single leg squat almost. Until you feel comfortable, then come back up. Good. Cam keeping his core nice and upright. Good. Really focusing on that core and pushing on that sliding leg. Normal, coming back up. Do you feel that stretch?
Yep.
Good. Going to do about 12 reps of these just to increase the capacity and strength of the adductor magnus. The muscles used in the sliding lateral lunge be the adductors, glutes, quads, and also the core muscles to keep nice and stable. The reasoning behind this exercise will be to increase range of motion. This is important as this is one of the problems on our patient's problem list. Exercises like this can increase range of motion because you're pushing the muscles to the end range of motion where they feel a soft tissue stretch. These exercises have been proven to increase flexibility in studies such as Morton et al. 2011. Another reason is that this has similar mechanics to our mechanism of injury. This is as the hip is externally rotated and the toes are pointing to 10 o'clock. This, as well as a lunge, is very similar to a mechanism of injury. This is important as it can help modify and desensitize pain, pain being one of the problems on the problem list. This gradual exposure can reduce pain and also strengthen the muscles in this range of motion. This can be seen with Cannon and Page 2018. Another reason for this exercise is we've got slow eccentric movements. This is important to increase strength and the capacity of this muscle, therefore increasing strength and reducing the likelihood of injury. The way we can progress this will be to extend and slide the leg out further and further, increasing the range of motion and the strength in different ranges of motion. But also we can add a resistance band, so it means it's harder for the hip to adduct again on the upward motion. Another way we can progress this will be do a weighted lateral lunge, focusing on the stabilizers of the muscle, but also the stretch as well that can be felt. Within this rehabilitation program, there are exercises like sliding lateral lunges and bull squeezes, which were also found in the strength program performed in Tyler et al. 2002. Tyler et al. 2002 found there was a reduction in adductor injuries threefold after the adductor strength program was administered, therefore showing that an increase in adductor strength may be indicative of a reduce in adductor strain injuries. This program follows a non-linear approach that was recommended by Riemann and Lorenz. This is as the volumes will increase and decrease compared with the load that's being put under. Therefore, if there's high volume, there'll be a low load, and if there's a high load, there'll be a low volume. Mechanotransduction is where mechanical load is then equal to a cellular response. Mechanotransduction has three parts: mechanocoupling, which is a physical effect on the cell; cell-to-cell communication, which is a signal of this physical effect to the rest of the cells; and the cell effect, which is what's happened to the cell from the stimulus. This helps with tissue repair and tissue remodeling. In summary, I think I should analyse my patient's movement patterns and assess them a little bit better. This is as when he was doing the hip thrusts, I saw it's quite hard for him to keep his spine in a nice neutral position while he was in the extended position. Therefore, I should have added some interventions to loosen off his hips so that he could better perform these movements. Even though my patient did have quite tight hips, he did say these exercises made him feel looser. Therefore, next time I'll try to add more of these interventions and maybe add some mobilizations as well to try and increase his range of motion.